So Cecile, given the role that nurse practitioners and physician's assistants currently occupy in medical practices, where do you see the role of sleep medicine fitting in terms of how they might incorporate that into the duties that they're already performing at their various levels and types of medical practices?
That is a great question, and I actually see three major areas that nurse practitioners or nurse practitioners as myself or physician assistants can embrace sleep medicine. And those three areas are: in primary care, we all know that the volume of patients that need to be seen in today's market, we cannot spend the time we would need to in any given specialty. So if we've identified, and obviously being educated to be able to identify these worsening conditions such as insomnia or apnea or a patient who's snoring, we absolutely want to be able to refer a patient. And this can take place in a primary care office, in an internal medicine office, in an OBGYN office, any of these primary levels that patients, this is often the only provider they see, we need to be able to identify that. And I know as a practitioner myself, I thrive on being able to be the one to send them to that next level personally. Secondly, in a specialty practice, if you're in a specialty practice already as a nurse practitioner or PA, to be able to embrace sleep as a complement to that specialty is absolutely a service that you can provide to your patient and be able to help them achieve a very strong level of wellness if we're addressing their apnea or their insomnia or restless leg movements that could be occurring. Having an education base that's directed towards my level of care as an NP or as a PA is imperative to be able to do that well. And as we know today also, the budgets for training is leaning less and less to be able to do much time in that. So we need to be able to come to practice prepared, just like we did with our board certification. Third, if you're in sleep specialty or in a sleep practice, as I am myself, as an NP, you really can embrace the ability to be able to work with your patients in so much more specialty and so much more focus on just their disease process that is disruptive to their life. And to be able to work with them and bring them to that healthier wellness state is very, very rewarding, both personally and professionally, every single day.